The chaotic reign of Doge, the Donald Trump-administered Department of Government Efficiency, headed by Elon Musk, continues to wreak havoc on vital U.S. health agencies. This controversial program, shrouded in secrecy and operating with unprecedented access, has triggered widespread concern and alarm within the federal government and beyond. The situation has escalated dramatically, marked by mass layoffs, questionable access to sensitive data, and a blatant disregard for established protocols. Trump's audacious attempt to grant Doge sweeping powers within the federal government has been met with fierce resistance, highlighting the deep-seated anxieties surrounding this seemingly unchecked entity. The executive order signed on Tuesday, aiming to empower Doge to drastically shrink the federal workforce, has ignited a firestorm of legal challenges from unions vehemently protesting Doge's unchecked access to sensitive information and systems. These lawsuits underscore the gravity of the situation and the potential for widespread abuse of power. The immediate consequences have been devastating. Thousands of employees across various health agencies, many of whom were probationary workers, were laid off on Friday, adding to the ongoing instability within the already strained healthcare system. The sheer scale of these layoffs, potentially numbering in the hundreds of thousands across the entire federal service, paints a grim picture of the potential long-term damage. This unprecedented purge of employees has left many agencies struggling to maintain essential services, creating significant vulnerabilities. The infiltration of Doge into the heart of the U.S. healthcare system raises serious concerns about data security and the potential for widespread fraud. Reports from the Wall Street Journal have revealed that Doge-affiliated officials have gained access to crucial payment and contracting systems at the Centers for Medicare and Medicaid. Elon Musk, serving as an unpaid special government employee, seemingly confirmed this access, alleging on X, formerly Twitter, on February 5th that this is where significant Medicare payment fraud is concentrated. This assertion, while potentially accurate, raises troubling questions about the motivations and methods employed by Doge in its investigation. The timing, coinciding with ongoing investigations into Medicare fraud exemplified by the arrest of 193 medical professionals in June under the Biden administration on charges related to $2.75 billion in suspected fraud adds another layer of complexity and suspicion. Further investigations from the Washington Post indicate that Doge representatives have also sought, and seemingly gained, access to HHS payment SIS. One system of particular concern is the Healthcare Integrated General Ledger Accounting System, a vast repository containing sensitive financial information on hospitals, doctors, and other healthcare organizations participating in crucial federal programs such as Medicare, Medicaid, and the Affordable Care Act. The implications of unauthorized access to this system are staggering, potentially exposing the entire U.S. healthcare system to significant financial and The potential for identity theft, financial fraud, and disruption of essential healthcare services is alarmingly high. The lax security and oversight surrounding Doge's activities have created a perfect storm for widespread abuse and potential disaster. The lack of transparency, coupled with the unchecked power granted to Doge, has raised serious questions about accountability and the potential for long-term damage to the integrity of the U.S. healthcare system. The situation demands immediate and thorough investigation, not only to ascertain the extent of Doge's access to sensitive systems, but also to determine the potential impact of its actions and to prevent future abuses of power. The ongoing legal battles, combined with the alarming reports of access to sensitive data and widespread layoffs, paint a deeply troubling picture of dysfunction and potential disaster within a critical sector of the U.S. government. The threat of infectious diseases like avian influenza further exacerbates the precarious situation, highlighting the critical need for a stable and functional healthcare system. The lack of transparency surrounding Doge's activities raises questions about accountability and the need for greater oversight in such sensitive areas. The potential for lasting damage to the nation's healthcare infrastructure and the erosion of public trust are significant and require immediate attention. The situation requires urgent intervention to mitigate the immediate risks and prevent future occurrences of such unchecked access to sensitive governmental systems.